Well, good morning, everybody, and thanks for coming to this, our local rally. You know, there's at least 20 or 30 of these rallies happening all over the state of Ohio right now in front of different representatives and senators. I think the big thing is that Medicaid expansion is important to every citizen in Ohio. And the reason we're here is to make a point that it's not just stuff happens in Columbus, but stuff happens here, and Medicaid expansion is going to make a big difference for all of us. I want to especially thank Phil Atkins and Marcy Godfrey, who were the ones who kind of put this whole thing together. Yes! And the biggest supporter of Medicaid expansion in our area is Janis Sunderhaus, who brought her entire family here to be with us. Janis, and my family is here too, what's left.
Hi. Listen, I think it's important, I run the Community Health Center out on 8th Street. And the health center really came to be because of local residents who didn't have a place to get primary health care. And what that meant is people were going to the hospital for services that could have been easily done in a family doctor's office or in a dental office or even at a counseling center. But because they had no place to go and nowhere to get that paid for, they'd end up in the emergency room. Often by the time they got to the emergency room, they were sicker than they were when they knew they first needed care, but they had to wait, hoping that it went away. Typically, sometimes it goes away and you can muscle through it, but a lot of times you end up at a more intense problem, something that could have been easily taken care of with some antibiotics ends up in full pneumonia and you're in ICU, or something that was a simple cavity could have been taken care of at your dental office ends up to be in an abscess. We actually had a young kid die in Washington, D.C. from a tooth abscess that went to his brain. So there's a lot of things. Hypertension can be managed very easily in a doctor's office, but it ends up in strokes and people end up in nursing homes. So what we're here to really talk about is that same movement that started about 10 years ago that created the Community Health Center. Is we're still moving to try to continue to take care of people. We estimate there's about 18,000 people in Allen County that still don't have a primary care home, and the biggest barrier to that is having the resources that we can grow to meet those needs and that people can have a way to get those things paid for. So what we're here today is to talk about a little bit about, this is part of the Affordable Care Act. People call it Obamacare. And, I know this is a very controversial issue, but let me tell you, does anyone think our healthcare system works? Yeah? Yeah, they do or no? Okay, so we know we've got to fix it. I want to talk for a minute about the Social Security Act that was put together in 1935. 1935, we put an act out there. It was called Social Security, and it was to take care of our women who had most of their husbands died in military. And we figured we had all these women who were living into their old age with no way to sustain themselves. So we created the Social Security Act. The Social Security Act has been modified probably 10 or 15 times over the last almost, 80 years since it's been around. It'll be 80 years in 2 more years. First time it was a lump sum payment, then it went to include children, then it went to be a monthly payment, then people started getting cost of living adjustments, and then people, if you were disabled, they could get Social Security. So over the last 80 years, it has changed time and time again. Do we think the Affordable Care Act is perfect? No. Do we need to modify it and work to make it better? Absolutely yes. But we have to have a place to start. And quite honestly, Medicaid expansion for the state of Ohio is the place we start. That will get 370,000 Ohioans covered for preventative visits, counseling services, dental visits, all of those things that quite honestly, people living on $7.60 an hour can't afford. Who can afford, if you're living on $7.60 to take a day off work to go pay a dentist to clean your teeth? Not happening. You can't afford it, you can't do it, so you don't think about it. You wake up in the middle of the night with a toothache. And then what do? No dentist will take you unless you got $200 upfront cash. Anybody making $7.60 have $200 in cash in their dresser drawer waiting for a dental ache? No. So what do? You end up in the emergency room. What do? Antibiotics? and send you home. You feel better?
No.
Well, maybe for a week. And in 2 weeks, guess where you're back? The emergency room. The system we have doesn't work. So, though I'm not saying the Affordable Care Act is perfect, but we have to have a first step. And this first step for Ohio will mean 370,000 Ohioans could get coverage into a family doctor, into a dentist, into counseling. If they're not there, where they're going to be? ERs, end-stage dialysis, not treated, nursing homes, dead. How about the jails? 65% of the people in jails have alcohol and substance abuse. Those are approved medical conditions. Let's give people treatment instead of locking people up. So what we're asking today, we're not saying the Affordable Care Act is perfect. We know that it's controversial, but 24 other states are going to say yes to Medicaid expansion. Michigan is saying yes. Kentucky is saying yes. West Virginia? Yes. Indiana? Yes. What that means for us is we're going to be centered around people who are going to be taking care of poor people with their tax dollars. Whose tax dollars are going to take care of Michigan and Kentucky and West Virginia's people? Ours. Our tax dollars are going to be going to take care of poor people, just not in our state. So we got to talk about this. These are jobs. You know how many of the jobs Medicaid expansion will create in Allen County?
How many?
343 good-paying healthcare jobs. Now, listen, we got Rhodes College out there, we got OSU, we got University of Northwest Ohio with medical assistant, LPN, nursing programs. Do we want those people going to Kentucky or Indiana or West Virginia for their jobs? Do we want them staying here in their hometown? Yes. So, health reform is a marathon. It is not a sprint. It's not something that this one law is going to take care of, but we need partners together who are going to work with us. We need House Representative Matt Huffman, who I know believes and cares for people. We need him at the table with us. We need him working on reforming the Affordable Care Act. We need Senator Keith Faber with us. Is it perfect? No, it's not. But we can't walk away from the care of 370,000 people and say goodbye to, listen, I got my numbers from, I didn't want to be telling lies to you guys, so I called the state people. $13 billion over 7 years would come into the state of Ohio of federal dollars if we do Medicaid expansion. That $13 billion is going to be spent one way or another. The decision will be made is whether it will be in Ohio or whether it will be in Michigan, Kentucky, West Virginia, Indiana, New York, New Jersey, California, all these other places that we will compete with. Now, if that money goes there, what else goes with them? Jobs! People say, Republicans, all we care about is jobs. We better think about this, because if 13 billion of our tax dollars goes to other states, so will our jobs. And you know what? I drag my kids to all these rallies. I got 2 girls back there, both in nursing school. And I really don't want them to have to go to California to have a good job. I'd like them to stay in Ohio and have a nice, good paying nursing job. So when we want to keep nursing jobs here, and respiratory therapists and pharmacists and counselors and all of that, we need to start with Medicaid expansion. It's the safety net that we will start with, and we will be good partners to work with both sides of the aisle on how we can get it to be the best bill that takes care of our people, so that people have a way to go to the right care at the right time in the right place that is kind, compassionate, and high quality. So that's all I have to say. Thank you all for coming out.
Thanks, Janis.
We're going to be presenting these to Matt Huffman and Keith Faber, all the people that say we need it. Okay.
Fantastic. A couple of just sobering thoughts that from the mental health and alcohol and drug side. There are more opiate deaths due to overdoses than there were people dying of traffic accidents. More people die of opiate overdoses than traffic accidents. That's unacceptable. I mean, that's a terrible situation that Medicaid expansion at least could address by giving people treatment and medications that they need We have people dying dying needlessly. Suicide is the third leading cause of death for young people between 18 and 24. The third leading cause of death. So you think of cancer, you think of traffic deaths, whatever it is, but suicide. And this is the one that really hit me. There are more active duty soldiers dying of suicide than in combat. More active duty soldiers are dying of suicide. That's according to the Department of Defense. More are dying of suicide than in active combat. Now we call these people our heroes. They're protecting our country and us with their lives, and yet they come home and there isn't the care that they need. Medicaid expansion would cover 26,000 veterans. 26,000 veterans. So not expanding Medicaid really tells our heroes and our brothers and our sisters and our neighbors who have gone to defend us that they're not really worth it because we're not willing to provide them the health care that they need. Now, I believe that what Janis said is true, that Matt Huffman, Keith Faber, they're compassionate, they don't understand, or maybe they don't really believe in what we believe in terms of getting this done now. But I think we have to convince them that this is an important issue for all of us here, all of us in Allen County and Auglaize County and Hardin County, that this is an important issue that affects the lives of people we know and love. And that's why we're here today. We're here today because they can't speak for themselves, and they depend on you, all of us, to speak for them and to tell our legislators that really it's people and it's not politics. It's people and it's not politics. So let's forget about Obamacare. Let's forget about the Affordable Care Act. Let's just say our people need help, and this is the way that they can get the help that they need.
All right.
Thank you.
Yay! Medicaid now!
Medicaid now! Medicaid now! Medicaid now! Medicaid now! Medicaid now!
Medicaid now!
Well, that's all that I have. I don't know if Phil or Marcy.
Thank you for coming.
We appreciate your being here. I guess the last thing that I'll say is this, that Janis from Health Partners, come over here, Janis, she has worked tirelessly to develop not only that program on 8th Street, but programs in various parts of our state. Without her work, we would have even more people dying because of the programs that she's developed, because she wasn't afraid to bring federal aid and federal programs and federal money into Lima, Allen County to get that done. I mean, if you haven't been to the 8th Street Clinic, it's fantastic. We've done work to expand our crisis stabilization unit, to expand psychiatry, to do everything we can. I mean, we have tapped out every dollar that we can to try to address the situation. It's not that we're sitting on our hands and waiting for somebody to give us a handout. I mean, we're working hard to try to develop those programs that we all need. Isn't it time, when we have the opportunity to get the funds that would make a huge difference in our area, that we get those funds that could really make a difference? That's all we're asking for. We're not asking for a handout. We're not asking for people to just give us something for nothing. We're saying we've done the work. We've done the work. We've all done the work. Now give us the funds that would help us to finish the job that we've begun already.
Yeah. All right.
I always have a last word.
I said, I always have a last word. Hey, listen, this isn't over. We live in a democracy, and we have state representatives and senators and a governor. But you know what? We also have a ballot box, and how issue 2 was put on the ballot box, and the residents of the state of Ohio said no. There's actually movement to put this on the ballot too, and so don't think this is over. It's not over, and until there's a lot of fat ladies and skinny ladies and fat men and skinny men who are going to say, let's put it on the ballot so that we actually have the residents of Ohio say where we're at. So, there's, like I said, this is a marathon. It's not a sprint. It won't be over today. So you got to hang in there with us for the long haul. So thank you all for coming out.
Email, call, don't stop the information going to Matt and to Keith and everybody else. Thanks very much, everybody.
All right.